One night of ecstasy can damage brain. Drug plays Russian roulette with brain function. Overview. Methylene dioxymethamphetamine, or MDMA, is a substituted phenethylamine that has psychedelic and pathogenic effects. It does this as a triple reuptake inhibitor, an inhibitor of the vesicular monoamine transporter 2, and a triple releasing agent. In short, it enhances the effects of serotonin, norepinephrine, and dopamine. It also has downstream enhancement of oxytocin, vasopressin, and prolactin. It's currently in Phase 3 FDA trials with a breakthrough therapy designation, and a single dose for humans is generally 100 to 120 milligrams. The present study. Researchers used non-human primates to evaluate the neurotoxicity of what they determined to be a dose regimen of MDMA often used by people at dance parties. They administered 2 milligrams per kilogram at 3-hour intervals up to 3 times to 5 squirrel monkeys and 5 baboons. 2 out of 10 of the monkeys died from malignant hyperthermia shortly after their dosings. Weeks later, they performed chemical and anatomical analyses on the subjects and found that there were lasting reductions of serotonergic and dopaminergic markers. Claims. 1. MDMA is a serotonergic neurotoxin. 2. MDMA is a dopaminergic neurotoxin. 3. Individuals who use MDMA on one occasion are at risk of substantial brain injury if they use 2 or 3 sequential doses hours apart. 4. MDMA may contribute to young-onset Parkinson's disease and other neuropsychiatric diseases involving serotonin or dopamine deficiency. Counter-argument to claims 1 and 3. In line with the present research's claims, there is evidence for long-term serotonergic neurotoxicity in animals after single-dose or sequential dose administration of MDMA. Many preclinical studies have shown that administration of MDMA to a variety of animals reveals chemical and anatomical markers of serotonergic neurotoxicity. However, the conclusions of this study and other studies are inaccurate due to overestimating the scaling of doses between humans and animals. One literature review found that nearly all the preclinical studies reviewed exceeded human equivalent doses by 2.7 to 10.7 times. These doses would be very dangerous or deadly to human beings. This was further evidenced by a study that used squirrel monkeys, just like the current study. The researchers used an interspecies scaling method to determine a dosage for the monkey equivalent to a human 100 milligram dose. They then measured the plasma concentrations in the monkeys, which revealed that they were 3 times higher than humans taking the supposedly equal dose. This suggests that normal scaling methods result in inaccurate translations of dose response between animals and humans. Research shows that there are serotonergic changes after MDMA use, but they are mostly transient and not neurotoxic. In general, MDMA use is associated with an acute drop in serotonin levels for a short time, but does not have actual neurotoxic effects. MDMA has recently been going through clinical trials as an adjunct to psychotherapy. During these studies, the researchers have also measured cognitive function before and 2 months after treatment. The patients in these trials reported either no change or increased cognitive function post-treatment. This suggests that clinical doses of MDMA do not cause functional changes in cognition. Counter-argument to claims 2 and 4. MDMA has much less significant effects on the dopamine system compared to the serotonin system. To that effect, it does not cause deficiencies in dopamine and therefore does not contribute to Parkinson's. Research has shown that even at high doses, MDMA does not cause any dopaminergic changes except to developing fetuses and infants. This directly contradicts the extraordinary dopaminergic changes the researchers of the present study found. As mentioned earlier, MDMA-assisted psychotherapy is currently undergoing Phase 3 FDA clinical trials. It has shown incredible results in treating chronic, treatment-resistant post-traumatic stress disorder, or PTSD, with over half the participants no longer qualifying for PTSD post-treatment in some trials. Not only did the claims of this study seem to be inaccurate about MDMA, but about a year later after publishing this paper, the authors retracted the results after realizing that the drug they used in the study was in fact methamphetamine. Methamphetamine has a proven serotonergic and dopaminergic neurotoxic profile, and also has a much smaller active dose in humans than MDMA. This suggests the study's results were due to a massive overdose of methamphetamine. In conclusion, research on the toxicity of MDMA is poorly translated to reflect human use. MDMA requires further accurate research, but does not seem to cause any brain damage at clinical human doses, contrary to what the present study claims. MDMA is currently undergoing clinical trials, and preliminary results point toward it being an extremely effective and safe treatment for PTSD. The present study not only made outrageous claims about MDMA, but their claims were based off of the careless mistake of using the wrong drug in a peer-reviewed, published study. Researchers need to be careful with their methodology and remain unbiased when conducting their research. And finally, as consumers of media, we must be conscious of media reporting of science and the biases involved in scientific research. A final note on MDMA research. In 2004, the Multidisciplinary Association for Psychedelic Studies, or MAPS for short, issued a report on documents obtained through the Freedom of Information Act, which revealed that the authors of the present study had received over $14.6 million in federal grants for MDMA research. They stated that such a massive amount of money suggests that the authors had some big incentives to exaggerate the risks of MDMA. In Phase 3 trials, the FDA has given MDMA breakthrough therapy designation, which indicates that the treatment may have a meaningful advantage and greater compliance over available medications for PTSD. Despite this, every dollar used to fund MDMA research has been privately funded, or funded by the Colorado state government as of recently. This suggests that the federal government is only interested in funding research that leans toward reporting negative things about MDMA, and consumers of the media and science reporting should be aware of this discrepancy. Please help support the most effective treatment for PTSD ever found by going to maps.org/donate. Thank you.